The COVID-19 pandemic is caused by the SARS-CoV-2 virus, a novel coronavirus. It was first identified in December 2019 in the city of Wuhan, Hubei Province, China. Initial cases were linked to a seafood market where live animals were also sold, but the precise origin remains under investigation. The virus spread quickly across Wuhan and to other parts of China, raising concerns about its potential to become a global health crisis. On January 7, 2020, the World Health Organization confirmed the identification of the virus, and by January 30, 2020, it was declared a public health emergency of international concern. As the virus spread internationally, countries around the world began reporting cases. By March 11, 2020, the World Health Organization declared COVID-19 a pandemic, meaning it was no longer confined to certain regions but was spreading worldwide. Countries scrambled to respond. Italy, Spain, Iran, and the United States became hotspots in early 2020. Hospitals became overwhelmed, and healthcare systems struggled to manage the influx of cases. The virus's rapid spread was facilitated by asymptomatic transmission, people spreading the virus without showing symptoms, and the fact that it could spread via respiratory droplets. COVID-19 primarily affected the respiratory system, causing symptoms like fever, cough, and shortness of breath. In severe cases, it led to pneumonia and acute respiratory distress syndrome, resulting in death, especially among the elderly or those with underlying health conditions. The fatality rate varied by country and population but was generally estimated to be between 1 to 3%. The pandemic disrupted daily life on an unprecedented scale, impacting healthcare systems, economies, and social structures. Entire industries were shut down, and millions lost jobs or were forced to adapt to remote work. In response to the growing crisis, many countries implemented lockdowns to try and slow the spread of the virus. These lockdowns varied in severity. People were required to stay home except for essential activities like grocery shopping or exercising. People who were infected or had been exposed to the virus were required to quarantine at home or in medical facilities. Schools, universities, and businesses were closed or moved online. Many countries closed their borders or imposed strict travel restrictions. People were advised to stay at least 6 feet apart in public. The lockdowns led to widespread economic downturns. The global economy went into a recession, with millions of jobs lost, stock markets plunging, and small businesses facing financial hardship. Governments introduced stimulus packages to provide financial support, including direct payments to citizens and loans to businesses. The mental health impact was also significant. Many people faced feelings of isolation, anxiety, and stress due to uncertainty, loss of work, and the constant threat of illness. Social gatherings were restricted, and traditional events like weddings, funerals, and holidays had to be altered or canceled. As the pandemic worsened, scientists and pharmaceutical companies around the world began working on vaccines. By December 2020, several vaccines were authorized for emergency use, including those developed by Pfizer-BioNTech, Moderna, and AstraZeneca. These vaccines were heralded as a turning point in the fight against COVID-19, but distribution was initially slow, especially in developing countries. The global vaccination campaign ramped up in 2021, with millions of people receiving vaccines to prevent severe illness and death. However, vaccine hesitancy and logistical challenges, such as distribution in remote areas, continued to pose significant challenges. As the virus spread, it began to mutate, leading to the emergence of new variants. Some of these variants, like the Delta variant, were more transmissible and caused concern. The Omicron variant, which emerged in late 2021, was notable for its high number of mutations, though it was generally considered less severe in terms of causing severe illness, especially among vaccinated individuals. By 2022 and 2023, many countries began transitioning out of lockdowns and easing restrictions, especially as vaccination rates increased and new treatments for COVID-19 were developed. However, new waves of infection, particularly in countries with lower vaccination rates or less stringent public health measures, caused continued disruptions. Countries adopted a more COVID-19 endemic approach, treating the virus like a seasonal illness that could be managed with vaccines, treatments, and public health campaigns. The COVID-19 pandemic has left an indelible mark on the world. It has reshaped how we think about global health, work, and society. The world has become more interconnected and yet more cautious, with lessons learned about the importance of preparedness, international cooperation, and the need for rapid scientific research. Governments are now better equipped to handle future pandemics, though the social, economic, and mental health repercussions of COVID-19 will likely continue to be felt for years to come. While the world has adapted to living with COVID-19 in many places, the memory of the lockdowns, restrictions, and losses during the early days of the pandemic will remain a significant chapter in history. For more informative videos, subscribe to Storyscape.